Hello everyone, welcome to Physio For You Podcast. Your host, Giri Srinivasan, registered physiotherapist. Hey there friends, welcome to the very first episode of Physio For You, the podcast that gets you moving, keeps you grooving, and helps you bounce back from injuries like a champ. I'm your host, Giri Srinivasan, physiotherapist, clinic director, and your friendly guide to everything rehab, recovery, and real life resilience. Now, let's kick things off. Quite literally, with an injury that got athletes and weekend warriors alike holding their thighs in agony. Yep, we are talking about hamstring strains. Whether you are sprinting to catch a bus, stretching too far in hot yoga, or trying to impress your dog in the park with a cartwheel, hamstrings will really humble you. What just happened to my hamstring? Let's say you are in a mid-run or mid-game. Hey, even mid-dance at your cousin's wedding. And bam, you feel the dreaded ping in the back of your thigh. We all would have got it once, if you're not already. Here's the deal. Not all hamstring injuries are created equal. Some happen during high-speed sprinting and others during a deep stretch. And that's where we, your friendly neighborhood physios, comes in, knowing how you injured it. Was it a sprint or was it a stretch? Help us figure out how bad it is and what needs to happen next. On a quick side note, if your hamstring pain started mysteriously while you're sitting at a desk and eating chips, we might be looking at something else entirely. Referral pain is real, people. It can come from your lower back. It may not be hamstring. So, if you're unsure, get assessed. Don't Google it and panic. Book a physio, not a WebMD rabbit hole. The strength behind the strain. Let's talk about testing. And no, I don't mean school exams. This is way cooler. We have fun little challenges like the bridge test. You will see the video. Number one I'm going to show you is the bridge test. Basically, let's suspecting injury to the right hamstring. What we're going to do, I'm going to put her leg onto my shoulder. Leave it there. This is a short lever test. So we're going to ask her to bend this knee 90-90 like that. And then we're going to ask the patient to bridge. Lift the pelvis up. There you go. And see how it is, how they feel in this area. Any pain? Okay, go down slowly. So if you have a hamstring tear or compromise, the patient is going to have some pain or kind of severe discomfort in this area. And then you know the location and the intensity of pain on the hamstrings. So this is the bridge test. What you did for the short lever. You can also do the long lever like this. Now you're going to bend this knee again, 90-90. And then I want you to lift your pelvis up. So this is the long lever bridge test. And also the max hip flexion active knee extension test. It's also called as MH fake test. Yeah, sounds like a TikTok dance, doesn't it? Maximum hip flexion and then active knee extension test. Ask the patient to do this, straighten this, and then they will experience pain and discomfort in this area. Then you will know the intensity and the location of the pain. Okay, you can relax that. So that's the second test you can do for hamstring tear. These help us to see how the hamstring is coping. We palpate. Palpate is just a fancy word for pressing around in the human body, right? We palpate to find out how sore, tender, or dramatic your injury is being. Then the real detective work starts, strength testing. We test your muscles while you're lying on your belly, on your back, and sometimes suspended in the ways you didn't even think were legal. Some physios use force plates and dynamometers, those high-tech toys that make physios kind of nerd out. This tells us not just how strong your hamstrings are, but how explosive they can be. Because let's be honest, who does not want explosive hamstrings? Next, we're going to see whether to scan or not to scan your hamstring injury. Patients always ask me, should I get an MRI? And I say, maybe. MRIs and ultrasounds are great tools. They can show us the tear, help grade it, and rule out scary stuff. But they're not always necessary. Most hamstring injuries can be managed without surgery, especially when caught early and rehabbed properly. In fact, a well-managed non-surgical hamstring rehab can perform just as well as surgery in the long term. And hey, no scalpels involved. Win-win situation. Next, rehab is not just rest. Here's the golden rule. Rest is not rehab. Rehab is work. And you have to be willing to do that. Smart, progressive, and evidence-based and evidence-informed work. In the early days, we are all about mobility and gentle strengthening. But the goal is to get you running, sprinting, and returning to sport safely. We look for at least 70% of your pre-injury strength before you let you hit the treadmill again or run again. Then we crank up the intensity with very sport-specific drills. Yep, even burpees for some of you. We also use GPS tracking monitors and also devices to kind of monitor your running volumes, especially for athletes. Think of it like Fitbit on steroids. It helps us avoid too much, too soon trap, which is basically the leading cause of re-injury and also making the physios grumpy again. So now, you might ask, why did this happen? And how do I prevent it? Let me tell you a secret. The best treatment for hamstring injuries is actually preventing them. So what are the biggest risk factors for you to get an hamstring injury? Obviously, previous hamstring injuries, you had it, you never got treated or you didn't rehab properly. ACL reconstructions. Why? Because where do they take a tendon from for ACL reconstruction? Most of the times it's your hamstring tendon. So you are compromising a bit of your hamstring for your ACL. Evidence says it's also one of the reasons for hamstring injuries as well. And yeah, poor training habits. You know who you are. So what do we do about it? Nordic Hamstring Curls. Nordic Hamstring Curl is one of the best strengthening exercises for your hamstrings. It has to be done gradedly, and the research data proves it's one of the best exercises to prevent hamstring injury. Basically, patient is kneeling down. I gave a foam to get the comfort of the knees. You can also do it on the ground if they want. You are stabilizing on the back of that leg, lower leg here. You are stabilizing that. Ask the patient to lean forward without any movement in the hips, and then come back. So you can see how she's trying to move from the pelvis. You got to stabilize this area. As the patient not move from here. They have to move the whole trunk and the leg as one unit. No bending from here. That's a very important thing. Go again forward as much as you can and then come back. How does that feel? Where do you feel it? It's hard. It's not an easy exercise. So you have to be having proper guidance, professional guidance to do this exercise. Otherwise, you'll be in trouble. So that's your most effective exercise, Nordic Hamstring Curl for strengthening of hamstrings. Love them or hate them, they are like the broccoli of physio. Nobody craves them, but everyone benefits from them. So pair those with solid strength work and load monitoring. You are building hamstrings that do not quit at all for you. So, when do you call a physio? Here's a quick checklist. If you got any of the following things, you got to call your physio. Any ping, pop or pull in the back of your thigh. You have trouble walking, sprinting or even sitting, even getting up from the chair. You have to hold your thigh. Yes, you got to call your physio. Recurring tightness that massage don't fix. Massage cannot fix everything, right? And your hamstring been off since that pickup soccer game 3 weeks ago. Do not wait. Book a physio assessment. The sooner you start, the faster and stronger you recover. And at Physio For You Podcast, we just don't help you to treat injuries. We coach performance. We prevent problems. We keep you in the game, whatever your game is. So, yeah, move better, live better. Alright, that's a wrap for episode 1 for Physio For You Podcast. If you found this helpful, share it with your running buddy, your workout partner, or your cousin who still thinks static stretching before sprinting is a good idea. Spoiler alert, it's not. Want to know if your hamstrings are hiding a ticking time bomb or just want to feel strong, mobile and ready for life? Book your assessment today at your neighborhood physio clinic, or if you want to visit any one of our 13 clinics in and around Edmonton under Synaptic Integrated Health Group, you can check our website, call and book an appointment. Check out Instagram, check out Physio For You for tips, stories and few good laughs. Until next time, keep moving, stay strong and remember, rehab is a journey, not a punishment. Bye.